All right, today we're diving into the really critical world of pediatric emergencies. When a child is in distress, every single second counts. But here's the thing. Kids are not just little adults. Their bodies react in totally unique ways, and really understanding those differences is the key to spotting a true crisis. So let's start with a really important question.
So why is it that something as common as a cold, a minor annoyance for us, can turn into a life-threatening event for a tiny baby? The answer, and it's a big one, is all about their anatomy.
And this really drives the point home. Just look at this comparison. In an adult airway, 1 tiny millimeter of swelling, you'd barely notice it. But in an infant's airway, which is already so small, that exact same millimeter of swelling can block a massive chunk of their breathing space. We're talking severe difficulty breathing almost instantly. It's a game of scale, and for kids, that scale is incredibly small.
So the bottom line is that kids are just built differently. First off, their airways are way smaller, so they get blocked super easily. They're also belly breathers, meaning they rely almost entirely on their diaphragm. What does that mean? Well, any problem in their abdomen, any swelling or pressure can directly mess with their breathing. Their chest walls are also softer, which is why you see retractions. That's when the skin sucks in between the ribs. It's a classic sign of distress. And to top it all off, their metabolism is in overdrive, so they burn through oxygen like crazy and have almost no reserves. They can go from looking okay to being in serious trouble in the blink of an eye.
Okay, so with that foundation in mind, let's start looking at some specific emergencies, beginning with problems that are there right from birth. These are called congenital abdominal wall defects.
Now, there are 2 main types of these defects we're going to talk about, and honestly, there's a super simple way to tell them apart. Before we get into the nitty-gritty, just burn this into your brain. One has a protective sac, and one doesn't. Simple as that.
Okay, let's break this down. With an omphalocele, the organs are coming out through the umbilical cord. But, and this is key, they're tucked away safely inside a protective sac. The memory trick here is great. O for organ, I for in, and S for sac. The catch is that this condition often comes with other major problems, especially heart defects. Now, gastroschisis is a whole different story. Here, the guts are literally just hanging out, no sac. They come through a hole right beside the belly button, and the big, immediate dangers are massive heat loss and a huge risk of infection because that bowel is totally exposed to the outside world.
All right, another really big congenital issue is called Hirschsprung disease. To put it simply, it means a part of the baby's large intestine was born without the nerve cells it needs. These are the cells that are supposed to tell the muscles, hey, squeeze and push the stool along.
And this creates what is basically a massive traffic jam in the gut. That section without the nerve cells, it can't get the signal to move, so it just stays rigid and tight. Stool can't get through this bottleneck, so it gets trapped. It just keeps backing up, causing the intestine above it to swell up like a giant balloon. This isn't just a case of bad constipation, it is a total mechanical blockage right from day one.
Okay, let's switch gears a bit. We're going to move from issues that are present at birth to emergencies that can pop up seemingly out of nowhere in a perfectly healthy child.
And that brings us to Intussusception. The best way to picture what's happening here is to think of an old-school collapsible telescope. That's exactly what the intestine does. One part literally slides, or telescopes, into the part right next to it. This creates a blockage for sure, but the really critical danger is that it pinches off and cuts off the blood supply to that piece of bowel.
And listen, when we talk about intussusception, there is one sign, one phrase that is so specific, so classic, that it's practically a diagnosis in a diaper. It's a term you absolutely positively need to know: current jelly stool.
So what is it exactly? Well, it's a mix of blood and mucus in the diaper that looks just like current jelly. When you see this, it's a screaming signal that the telescoped bowel is getting injured and is losing its blood flow. This isn't just a heads up, it is a 5-alarm fire. It means a medical emergency is happening right now, and that part of the bowel is at risk of dying.
Sometimes, to save a child's life during one of these emergencies, surgeons have to make a tough call and remove a damaged piece of the intestine. But that life-saving step can sometimes lead to a chronic, lifelong condition.
And that condition is called short bowel syndrome. It's pretty much what it sounds like. The child is literally left with an intestine that's too short to do its job properly. It can't absorb enough nutrients from food, and that leads to all kinds of problems, like severe malabsorption and not being able to grow.
So that poses a really tough question, right? If the gut can't absorb food, how in the world do you keep a child alive and growing? And maybe more importantly, what are the hidden dangers that come with the solution?
The lifeline is something called TPN, which stands for Total Parenteral Nutrition. It's pretty amazing. It completely bypasses the broken gut and delivers a custom-made liquid mix of all the nutrients a kid needs directly into their bloodstream through a special IV called a central line. It's a modern medical miracle for sure, but, and this is a huge but, it comes with a massive risk, CLABSI. That's central line associated bloodstream infections. That central line is basically a direct highway for germs to get into the body, making a serious infection a constant and potentially deadly threat.
Okay, we've gone through some really heavy, complex stuff. So now let's boil it all down to the most important, most actionable part, the critical red flags. These are the distress signals that you just cannot afford to ignore.
First one, green or yellow vomit. This is also called bilious vomiting, and it is never, ever normal in a child. It's a huge sign that there's a blockage somewhere after the stomach and bile is backing up. This is a surgical emergency until a doctor proves it's not.
Next up, explosive, foul-smelling diarrhea. We're not talking about a little tummy bug here. This is a key sign of something called enterocolitis, a life-threatening inflammation of the bowel, and it's the single most dangerous complication of Hirschsprung disease.
Here's another one that's a classic for Hirschsprung's, ribbon-like stools. It's a strange visual, but it tells you exactly what's happening. The stool is so backed up that only thin liquid bits can squeeze past that tight, non-working part of the bowel. It's a dead giveaway for a severe blockage.
And here's one that's a little different. It's not a gut issue, but it's a pediatric red flag you have to know. After tonsil surgery, if you see a child swallowing over and over again, that is the #1 early sign of a post-op bleed. They're not spitting the blood out, they're swallowing it.
So let's pull this all together. Think of this as your ultimate gut check cheat sheet. In a newborn, if they don't pass that first black terry stool, the meconium, in the first day or two, that's a huge red flag for Hirschsprung's. In an infant, if they're screaming like crazy for a few minutes, then stop, then start again, all while pulling their knees to their chest, that's classic for Intussusception. We've talked about the current jelly stool, that's an emergency. And anytime a child's belly suddenly gets hard, swollen, and painful, or their whole behavior just changes, they get pale, limp, and lethargic, that's a sign they could be going into shock. These are the signals you just can't ignore.
Look, the point of knowing all this isn't to scare you or to turn you into a doctor overnight. It's about empowerment. It's about giving you the knowledge to act fast and get help when it matters most. So, what's the single most important takeaway from all of this? It's simple. When it comes to your kid, trust your gut instinct. More often than not, it's the most powerful diagnostic tool in the room.